sperm quality, or it's just a myth, or we should still wait for the results, for a conclusive results to come forward. So what is varicocele? Basically, varicocele is being known by everyone. They are nothing but dilated veins which are present within the spermatic cord around the testicle. So what selectomy is to target these changes, these metabolite changes which is happening at the cellular level. So as a varicocele, we have been correcting the macro parameters are being corrected, but by giving a PRP might be the micro parameters which I am talking about at the cellular level, the DNA level, or at the amino acid level or the metabolite level. We are trying to correct that also, so that the quality and the quantity both of the sperm is better. So dramatic improvement in the sperm DNA integrity. This we have seen that when we do a varicocelectomy, the DFI of the sperm in most of the cases improves. I mean to say, the DFI index decreases. If the DFI index is high, it means the sperm quality is not good. So when from a group of growth factors like platelet releasing growth factors including VEGF, IGF-1, PDGF and TGF-beta, which promotes the cellular repair and proliferation. So by adding a varicocelectomy along with PRP, what we routinely think or what we routinely like, it's nothing, it's not been proved yet because we have very small studies right now. So it's a futuristic idea that suppose if we add these both things together, the synergistic effect should have like a catalytic effect. It should not be like 1 plus 1 is equal to 1 like I have told. It should be having an exponential benefit to the patient, because there is improvement in the quality and the quantity of sperm, which at the end also affects the. And over a period of time, they have seen that might be some amount of sperms can be retrieved from them. These are certain clinically based things. So visualization transformation before treatment, what we see, there is oxidative damage, there is poor sperm morphology and high grade of DNA fragmentation, but post microsurgery and PRP enhancement, we can see that there is improvement not only in macro factors but also at the mitochondrial cellular level also. So limitations, this study is still limited because we have very few research activities which are going globally. So this very few samples or very few patient samples are having, we have to prove that yes, definitely PRP and varicocele is suggested in the patient. So whether it is improving the sperm quality or it's just a myth, or we should still wait for the results, for a conclusive results to come forward. So what is varicocele? Basically, varicocele is being known by everyone. They are nothing but dilated veins which are present within the spermatic cord around the testicle. So what label a person that yes, you are only having a psychogenic ED? No. Any psychogenic ED or vascular ED or hormonal imbalance will have other subsets also which need to be corrected at the same time. So I think holistic approach, as like any other disease, we should also have a holistic approach to it, and we should not point only on a specific area. And definitely by regenerative medicine, like the role of PRP is coming in erectile dysfunction, like shockwave therapies along with it, definitely the spectrum has become much more wide now. Now we definitely have an answer to the patient when he comes, oh, my medicines are not working. Then we have an answer or we have an alternative for them to be given. We have still a hope for them before they go for a surgery like within the testicle is not maintained, as a result of which the spermatogenesis is affected. That is the general, the information what we have. So I want to add something more beyond it. Why? Because what we are working in, what we are doing in regenerative medicine is something extra. It is like not 1 plus 1 is equal to 2. We are targeting as 1 plus 1 is equal to 4. We need to have an exponential results after adding regenerative medicines to the routine treatment what we are doing. So we need to know at the cellular level what the things are happening. So in varicocele, because of the spermatogenesis which is affected through oxidative stress, also due to testicular hypoxia and elevated scrotal temperature, varicocele affects almost 15 to 20% of the male infertility, and it is one of the only surgically correctable cause which can correct the male infertility almost to a greater extent. So in order to correct varicocele, we have a procedure called microsurgical varicocelectomy, which is the gold standard. So what exactly in microsurgical varicocelectomy we do? We precisely select the veins which are dilated. we separate the arteries, we separate the lymphatics, and we are more specific, or we can say we are more